Hi, my name is Ciara Nichleirigh. I'm an optometrist with the OutsideClinic. I do domiciliary home testing eyes, and today I'm going to be discussing communication with patients who have a difficult time with communication. One of the first things, which is very, very important, is introducing yourself when you arrive into someone's home. In a regular practice, they're coming to you, but in domiciliary eye testing, you're a guest in their house. So it might be your place of work, but it's their home. So introducing yourself, trying to get at their eye level so that they can see you and you can tell when they're looking at you rather than looking around the room, especially with patients with dementia. And so you can check that they are hearing and understanding what you're saying is very important.
Hello, my name's Ciara. I'm going to be doing your eye test with you today. How are you?
Okay.
These days now that masks have become a very central part of having your eyes tested, talking slowly and clearly helps patients to understand what you're saying better. It can be frustrating for them when you have to keep repeating yourself. So by saying it the right way the first time, that can help. Hand gestures can make it a lot easier for patients. So for instance, when you're asking them, do you ever get flashing lights? They like that. Or for double vision, I find, going like that, double vision, can help them kind of see what you're doing. And then rephrasing how you're saying. As someone who's not from the UK, sometimes if I just say it in a slightly different way, patients will understand. A big one for me is saying GP surgery instead of GP practice. In certain areas, surgery, they'll know what you're talking about rather than saying GP practice over and over again and hoping that they're going to understand what it is finally. So for very hard of hearing patients, the flip charts that have questions that have already been written out are really, really useful. We have one that has all the basic questions like, do you get any headaches? Have you had any injuries or infections? Also has very good information about dilating eye drops. So we have 3 or 4 pages that are all about tropicamide, your possible symptoms, the risks involved. And for a long subject like that, where you're hoping a patient, you want a patient to know what it is that you're talking about, having it all written out is quite nicely. If you don't have those flip cards, you can write it out yourself, but we have these nice ones that are already printed in large letters, so easy for the patient to understand. Some of our patients, they can hear us perfectly well, but they then have a hard time communicating with us, and that's where things like saying yes or no questions with a thumbs up or a thumbs down, or we have hobby cards, so you can say, do you have any of these hobbies, and show the cards, and they point to the ones that they do like.
Do you like playing cards? Yeah? And do you find it easy to see the cards up close when you see them?
Some patients, when they're looking at the chart, they'll be able to draw you the letters instead of saying them out loud. But we do have a lovely little chart that has the letters that match with the testing chart, so they can point to what they like. Different patients who do have problems with speaking, especially after a stroke and things like that, they'll have their own ways of managing how they communicate with people. So I think checking with them is quite good. A lot of these patients may even have their own matching charts or their own hobby charts. And so, they deal with it on a daily basis. So if you can use what they use, it'll be easier for them. So always, checking with the patient, seeing how they do things day to day, can be a great way of getting good communication from them, because it's what they're used to, rather than making them, communicating the way you want them to. Repeating or explaining what you're doing throughout the eye test is important for everyone, but for patients that we see, a lot of them may have dementia, so they may not ever remember having an eye test done, or they may not remember who you are during the eye test. So explaining each step as you go along helps to put the patients at ease, makes them feel more comfortable when you say, okay, in a few seconds I'm going to come closer to your face, so that they know to expect that from happening. Sometimes when you're in practice, you'll explain everything for one eye and then just do the other eye. But for patients with shorter term memory problems, explaining it for each eye as if it's the first time helps them feel less kind of frustrated by maybe not remembering what was done a second ago. And it just confirms that the patients are happy for you to do the same thing on the other eye. You never know, a patient might be fine with one eye and then get really nervous all of a sudden. So checking in constantly helps them and yourself feel more comfortable with the testing process. Patients who have dementia or possibly learning difficulties can sometimes have trouble with letters. So on charts where you have number charts or picture charts like our chart does, it's always worth trying out those different options and seeing what feels best for a patient, especially patients with learning difficulties. We sometimes see patients with Down syndrome or who have autism who wouldn't be as comfortable with letters or numbers, but if you show them a lovely picture of an apple or a card, they'll be happy to do that. It's like a matching game. So anything to make the whole process more enjoyable for a patient and get that communication flowing is a good way of trying out and seeing how they feel with it. Also good with patients who don't speak English as their first language or know the Roman alphabet. The numbers are great for that, and you can even hold up number 1, number 2, so it makes it even easier for patients who are who can't talk very well, so that they don't have to use the matching chart if they don't want to. That's why it's good checking with patients to see what way might work for them. With domiciliary eye tests, normally you're communicating with the patient, but a lot of the time you might be communicating with family members as well. And they may not always be there. A lot of our patients are happy getting their eyes tested on their own, but they have family members who want to check in on them. Calling the family beforehand, letting them know that you're going to be with the patient on the day of, if the patient has consented for the family members to talk to us about their eyes, is important. It's also great because it means if you do have to ask a family member about something that maybe a patient can't remember, they know that you're there, they're expecting your phone call. Ideally as well, if you can, it's great to be able to call the family members at the end of the eye test, explain everything that went on. Helps take some of the pressure off the patient so that they're not thinking, oh, I have to try and remember to tell the family that I have a bit of cataracts but they're not too bad yet. And it also gives the family the opportunity to ask us any questions. So we can go through glasses, we can go through when the next eye test is, so that take some of the pressure off the head office. They're not having to answer those questions at a later date, and it builds that rapport with the family member if they've talked to the optometrist. It's better than talking to an admin person who works in the head office. They feel more at ease that way. Sometimes the family members are in the room and they'll want to have a talk to you, especially with patients who have dementia or who can't talk for themselves. The family can get very inclined to want to try and answer for the patient, and you can feel inclined. It's quicker to try and ask the family member all the questions, but the main thing you always have to remember is you're there to do the patient's eye test, not the family member's eye test. It's up to them as much as they can to answer in their own way how their eyes are feeling. And it also helps with later on in the eye test when you want to ask the patient a question that no one else in the room can answer. They're used to from the start having someone else answer for them. There's not that rapport there for the communication to flow. So letting them answer the questions when they can makes them more involved in the process and means you're going to get a better communication later on. Record keeping is always going to be an important part of doing your eye test. But especially for patients who have issues with their memory, recording on your own device how you did the eye test. So for instance, if you did use matching cards, that helps to make it easier for you when you're coming back to see them again the next year to know how you did the eye test, so that things are as consistent as possible. And if you have the information that you were recording and the advice that you were recording on the tablet for your patient, then that means that they don't have to try and remember everything. So everything's written down for them. I know if someone says something to me 5 minutes later, I might have forgotten it if I don't write it down. So it's great to be able to do that for the patients. It also means if a family member, you can't contact the family member at the time of the eye test, they can look through what you've written down for the patient. We have an information booklet that has some preset bits of information about cataracts, macular degeneration. It means you can circle the bits without having to write a whole spiel out on the piece of paper for the patient. So it means it's easy to access the information that's needed. Also a great way of keeping all their information at the end of the eye test. So the copy of the prescription, the receipts and things like that. Good communication is key to a good eye test. I hope you enjoyed this video and that it was useful for you, and thanks for watching.